Hi, everyone. This is Selena Ramsey. I'm here with my colleague, Sadia. We're from the Staten Island PPS, and we're excited to bring this series of 5 social determinant of health webinars to you. Today, we're going to be focusing on food insecurity on Staten Island and the food resources that are available. I just wanted to go over a couple of webinar kind of housekeeping items. The first one is that we're going to be muting everyone except the presenters. So if you have questions, please go ahead and use the chat box that's on the GoToMeeting platform. So you can type your question right in as they come up, and our team will be recording them, and we'll have some time at the end of the entire presentation to address those questions with each presenter. Also, this presentation is being recorded. We'll be sharing it on our website, and our website's right there, statenislandpps.org. And as I said before, this is one of 5 series on social determinants of health. So we hope that you love the interactions that you had today and sign up for the remaining 4. Okay, so we're going to get started. We have a really dynamic lineup of presenters today. Here they are. This is an overview of everybody that you'll be hearing on the PowerPoint on the webinar today. And we're going to be talking about social determinants. So we know that there's a gross overspend in healthcare in the United States and a gross underspend in social care and social services that our community so desperately needs. So we hope to touch on some of those issues and really make a powerful statement on what we are doing, what we have access to, and what we could be doing better. I'm just going to take a minute to introduce you to the agenda for today. So Sadia and I will be doing an introduction to the Staten Island PPS and to WeSource, which is actually our new social determinant of health app and screening tool. And we'll give you a little bit of firsthand insight on what that looks like, what the program is set up to do, and some of the data and outcomes from that. And then we have the Staten Island Hunger Task Force is going to be presenting on the emergency food situation on Staten Island, with a lot of really valuable information on how you can get involved as far as volunteering and advocacy. We'll also hear from City Harvest on their Staten Island-based initiatives, Community Health Action of Staten Island, and Project Hospitality. They'll be talking about the food resources that they have available. So for those of you who don't know, we are the Staten Island Performing Provider System. We are part of a Medicaid waiver to try to transform healthcare on Staten Island. So we started in 2015, where we are one of 25 PPSs across New York State working to improve the health and lifestyles of the Medicaid and uninsured populations. To date, we've reinvested over $130 million to transform the Staten Island healthcare ecosystem. We are made up of a network of over 75 different partners, partners in behavioral health, in long-term care, and community-based organizations among some of our partners. We're co-owned by the 2 hospitals, and our mission is to reduce avoidable hospitalizations and emergency department visits by 25% by 2020. We've surpassed that goal, and it all has to do with the amount of time and attention that our community partners are putting in to invest in the health of the clients that they serve. So one of our projects is the Social Determinant of Health project, which Sadia is going to talk a little bit more about in just a few minutes. But we wanted to kind of give you an overview of why is this important? What is happening with the Social Determinant of Health project? When the PPS started, we were able to look at data like the top left-hand box there, and we were able to see, it's called hotspotting. So we're able to see where the health disparities lie across the island. This one actually looks at diabetes in the adult population. So we're able to see like the darker colors are where those people live that have this diabetes issue and health disparity. So when we're looking just at the health incidences on Staten Island, we're really not able to get a clear picture of or a holistic view of everything that's happening in someone's life. So now that we're focused on social determinants of health and population health, we'll eventually be able to overlay the data that we collect through this new initiative on top of the data that we already have, that will paint a full picture of what's happening in our community's lives. So the PPS has already made significant investments in social determinants of health. We've reinvested over $7 million in many of these programs that are existing on Staten Island. Many of the partners that you're going to hear today have participated in PPS programs. So, you know, when we're thinking about somebody's wellness, we know that their social and lifestyle and behavioral choices and factors that impacts their ability to stay well more than their genetics or the healthcare access that they have. An interesting statistic that we've collected is that 80% of our patient population, they each have a chronic illness. They all report having some kind of social determinant of health issue, and we're going to look at some more of those factors in just a minute. But today we're here to talk about food access. So we can understand how access to food, and especially access to nutritious food, can either impact or impede a person's health and wellness. If I'm worried about where my next meal is coming from, I'm highly unlikely to concentrate on anything else, including my schoolwork, my job, or even my healthcare. So today we have a spectacular presentation for you, and I urge you to absorb the magnitude of the problem. I'll give you space to feel emotional, enraged, and enlightened about it. And I hope the resources that we share empower you with tools to connect your clients to food services and give you new ideas on how to advocate and move this conversation on food insecurities upstream. So without further ado, we're going to talk a little bit about the WeSource program, and we're going to get into our food resources. I'm going to pass the mic over to my colleague, Sadia.
Good afternoon, everyone. Hi, this is Sadia Chaudhary. I'm the Director of Ambulatory Care Initiatives at the PPS, and I have been involved with this SDOH program implementation with the PPS. And the project has launched in our PPS since July of this year. The PPS has worked with our CIO to develop this in-house app that we call WeSource, which we're using to, which our navigators in with our partner network are using to assess the clients for SDOH factors and also link them to appropriate resources. So we currently have 19 PPS partners, which includes our 2 major hospitals, the primary care partners. We have behavioral health organizations and community-based organizations that are participating right now in this project. And as a requirement of this program, the partners and the navigators are currently asked to identify the barriers as they survey the clients in terms of SDOH factors, and they're also required to make immediate linkages to appropriate resources, which we're going to go through just a quick snapshot of how it looks. They also are required to make appointment for PCPs if the clients don't have any PCP, haven't visited the PCP recently, or connect them to insurances. And one thing that we have really emphasized in our PPS program is to make sure the referrals are being closed and followed up within 4 weeks. And so Selena spoke about it earlier, and we also wanted to show some data to prove that. So from July 1st till September 10th, we had about 5,438 unique clients that have been surveyed, and we had more than 10,000 SDOH factors identified through those surveys. And what we have noticed is each survey had almost at least 2 SDOH factors identified, which kind of, again, makes it a point that, how these SDOH factors are so important to address. And as you can see, just in the summary table is that food, which food has the most need right now in this borough. Almost 35% of the clients that have been surveyed and needed some kind of urgent referrals for immediate food needs. just an FYI also, what we are doing as a PPS, we are going to use all the data that we collect to integrate in our population health platform and get a holistic view of patients. And we are also having primary care practices that have all these questions that we have in our surveys integrated in the EMR as well. And we have CBO agencies that are getting weekly emails and alerts from us, notifying them, that they have received, they will be expecting which clients for the referral. So just a quick snapshot of how the resource app looks like. So we have, you can see at the very left hand side of the slide are all the sections that are in the app right now. We have a consent collection section from clients if they are willing to be referred for resources, and if it's fine for them, for the navigator to share the information as they make referrals for the resources. And just to show, some snapshot of how we have developed the app. So for example, for food and nutrition, if that question asks, do you or your family ever feel hungry or, have immediate need for food, if the navigator says yes or urgent, based on the discussion with the client, they do get a pop-up where you can see, there is a link to Height, which is an inventor of all the resources in New York City. They get a link to the soup kitchen in the Staten Island, which, our partners are going to talk about in a few, and a resource guide, a PDF resource guide with all food pantries. Same for housing, and we're going to address it more in our housing webinar. And the last thing is a screenshot of how an email or a text that the patient can receive with all their basic demographics and only information on the referrals that the navigator has made for them on that visit.
And then, so we wanted to share with you how we developed the referral resources, which is actually fueling on the back end when the patient comes up with a need or a client comes up with, for example, a food need. These are the different types of referral resources that they have access to. We have developed a lot in-house. A lot has been taken from existing databases, and our navigators also have access to the Height site. And any questions for Sadia and I, please feel free to type them in the chat, and we'll be able to get those answered for you at the end of today's presentation. I did see a question come up, I think, from Jeff. We're going to be this session is going to be recorded, and we'll share everything with all the attendees right after the presentation. And thanks. Okay, so I'm so excited to announce to introduce to you the Staten Island Hunger Task Force. Neshama Marcus from the Jewish Community Center of Staten Island is going to be presenting this portion of the slides.
Hi, everyone, and thanks for having me. So I represent the Staten Island Hunger Task Force, which is a coalition committee of about somewhere between, I want to say, like 60 and 80 food pantries on Staten Island, all dedicated towards advocacy, advocating specifically for individuals and families who are food insecure. You can switch this one. Great, thank you. So the Hunger Task Force is committed to bringing awareness in our borough, like I said, in terms of advocacy, advocating to our elected officials. We have a legislative breakfast annually in order to see them one-on-one and provide some testimony. And it has our website on the bottom, hungryonstatenisland.com. So here's a few statistics. So on Staten Island, we have about 100,000 residents that experience food security, or what's called scarcity. That's usually missing a meal. We have about 70,000 Staten Islanders who rely on our food pantries and SNAP benefits in order to meet their hunger needs. We have about 47,000 Staten Islanders who continue to remain hungry, and you're going to see on the next few slides what that looks like. So this is a list of what's called our reporting pantries. So of those food pantries on Staten Island, not all of them receive funding from the city, state, or federal level, and are not required to submit their reports. But of those that submit their reports, this is the information that we have over the last 3 years. So in I'd say the middle column where it says number of meals for 2018, you can tell the pantries that have increased their level of serving meals over the last year and those that have declined over the last year. But you can tell that the number is still pretty high. There's still about 2 to 3 million meals that are being served on an annual basis. On the right-hand side, you'll see where it says total served. There are still 321,000 individuals plus who are receiving food from our food pantries. So this is what's called a meal gap on Staten Island. This is in addition to those who receive food through the food pantries, soup kitchens. There's still, over 4 million who are not receiving. I'm sorry, not individuals. 4 million meals that are not being provided just in Community District 1 alone, and then there's about 1 to 2 million for each of the other CDs. So I mentioned the Staten Island Hunger Task Force website. So if you go to the website, Hungry on Staten Island, you'll notice that there's a list of all the pantries in alphabetical order. It's also an interactive map where you can click on your community and find a meal. And this is a calendar, so it's interactive. So if you're interested in finding a meal, whether it's a food pantry or it's a soup kitchen, you can access food any day of the week. So these are the different ways to help. So you can either, if you are a food pantry and you're interested in joining the coalition, the Staten Island Hunger Task Force, you can feel free to contact me or you can contact that email that you saw earlier. You can also advocate and speak to your elected official about what you're noticing in your community. Oop, can you go back for 1 minute? Thanks so much. You can, if you are a community member, you can also volunteer in the pantry. You can visit the pantry, and you can donate to a pantry, whether it's food or financial support. Okay. So we do participate in food drives. There's some that are island-wide, like Bread of Life, and there are some that are designated for, designated pantries. But feel free to get involved. You can some take additional household goods, but all of them take food. Okay, so do you mind if I transition to the JCC Food Pantry? So the JCC provides about 450 families annually with over 7,500 food packages per year. Our hours of operation are Monday through Thursday, 10 to 7, and Friday, 10 to 2. They are by appointment only, which means that anyone who's interested in receiving food does not have to see their neighbor or somebody who they may not want to see. And our goal is really to reduce stigma associated with food security. Our food pantry is located at the Joan and Allen Burnett Cow JCC on Manor Road, right next to Wagner High School. We don't have any eligibility in order to participate in the food pantry. Nobody has to provide any documentation or financials. There's no fee to participate. If somebody needs food, we give them food. Some people ask if you have to be Jewish in order to receive food. No, we're open to all. It is a general food pantry. We do specialize in kosher because all of our food items are kosher. We also have a special section that's designated for people with dietary restrictions, whether it's like gluten-free, dairy-free, etc. So in addition to food pantry appointments, I mentioned food drives. We do, engage volunteers and do collections. We also do SNAP enrollment, direct on site, and we refer to other JCC internal programs and also some of the nonprofit community-based organizations you're going to hear later. So some of the JCC programs include case management. I mentioned SNAP and other benefits and entitlements. We have legal counseling on site for elder law, landlord-tenant disputes. People ask us questions all the time, and we do have an attorney from New York Legal Assistance Group who comes to our site. We also provide financial counseling or cash assistance, those who experience evictions or are close to it, emergency shutoffs. We have a health insurance enrollment office on Victory and Manor that does enrollments, renewals, appeals, and also care coordination, linking people who do receive Medicaid benefits with quality care. JCC also hosts adult literacy programs. We have high school equivalency and English as a second language all throughout Staten Island. We operate 3 senior centers, one in each community district. We also have a program called Family Solutions to Memory Loss, which is for individuals who have Alzheimer's disease related dementia and their family supports. We run 3 cornerstone programs, one at Richmond Terrace, one at Toad Hill, and one at the Gerard Carter Center. We also operate 2 Beacon programs, which are also community centers, one at Tottenville High School and the other one at IS 49. We run Sonic program at Eagle Academy and Compass Explore programs at PS 65. So a lot of people ask us for free childcare programs for their kids when they come for the food pantry, so that's accessible to them. We also operate a department for people with disabilities. That's Medicaid waiver program for individuals. They can be, as young as early childhood and through our day hab program as well. We have a Sunrise Day Camp, which is a free camp for children with cancer and their siblings. And we have Sunrise on Wheels, which is an engaging activity for individuals, for children who have cancer throughout the school year. And we have our early childhood education department. Thank you so much.
Hey everyone, this is Susan Fowler. It's good to be here today. My part of the webinar today, I want to talk about overall food insecurity and food access on Staten Island, which will help you see why we're all working in this area. Then City Harvest's own mission and programs, and especially the mobile market on Staten Island. Next slide. So here's some of the demographics of Staten Island. We do most, but not all of our work on the North Shore, and you can see why. 21% are living in poverty, 7% are unemployed. This is information from the Community Health Profiles from the City of New York. And actually, what's interesting, the poverty numbers have gone up since 2015, although unemployment has gone down. What's, I think, the most interesting piece is on the South Shore. It says living in poverty. As of now, it's 11%. It used to be 6%. So there's something going on the South Shore. Next slide. However, there's another aspect of food insecurity. The self-sufficiency standard looks at people who don't fall under the federal poverty guidelines, but they still can't make ends meet. This report was created by United Way, New York Community Trust, Women's Center for Education and Career Advancement, and City Harvest. So what this group found was over 900,000 working age households in New York lack enough income to cover just the necessities. But only a third of that number are poor according to the official poverty measure. And you can see on the chart on the right-hand side, to be self-sufficient, Staten Islanders need to bring in $5,512 a month. And that's for one adult and 2 school-age children. And their budget that they came up with, that they're using, covers housing, food, childcare, healthcare, transportation, miscellaneous, and taxes. So this 5,512 is before taxes. Next. The blue line is on this chart is Staten Island. It represents an annual salary of $79,000. What's interesting about this chart is, as I say, costs have increased 87% on average across the New York City boroughs, but median wages have only increased 31%. So the monthly total here for Staten Islanders is $5,959 on and that's the cost of living. But what Staten Islanders need to survive is $5,512. So there's a gap there of $447 a month. It's worse than some of the other boroughs, but still bad enough. Next slide. And this is a comparison of the 3 community boards on Staten Island or the community districts. So 38% in the North Shore are below the standard that we've been talking about, and Mid Island is 25%, and South Shore is 18%. So these are rather large numbers, even for the South Shore, which is one of the highest income areas in New York City. Next slide. There's some good news. Another area where City Harvest works is with food access in general, and trying to help eliminate food deserts. And you probably heard of the term food deserts. They're areas with no or few supermarkets where people can get fresh produce and other healthy food. Food access on Staten Island is better now for Richmond County in general. 81% fewer people are without access to supermarkets. So it went from 22,000 people in 2010 having no good access to supermarkets to only 4,000 in 2015. And that's because there's additional supermarkets on Staten Island since 2010. Next, yes. However, there are still food deserts, and you see it's the usual suspects: Mariners Harbor, Stapleton, St. George, South Beach, and you see the same kind of coloring on some of the other charts throughout this everyone's presentations. Next slide, please. One of the interesting things about the idea of food deserts, they turn out to be complicated. For years, USDA, New York City, City Harvest has assumed that people were shopping at delis for their food when they lived in a food desert. It turns out that they shop in supermarkets like everyone else. We surveyed mobile market participants and people at Community Health Action, the Trinity Lutheran Pantry, and Project Hospitality Pantries, and we found that most people were buying most of their groceries at supermarkets. Next slide. And they get there by bus, sometimes by their own car service, friends or relatives' cars, walking, and bicycle. Most people said also that they shop once a month. Next slide. And we also asked, which supermarkets do you go to? And as you can see, the ShopRite on Forest Avenue and Richmond Avenue is most popular, and it's followed by Western Beef on Bay Street. Now here's an interesting problem. If the North Shore rezoning eliminates Western Beef on Bay Street, which seems to be part of the conversation, it's going to eliminate a very important source of food, turning Stapleton back into a food desert, at least for people without cars. Next slide. We also have been assuming that low-income people are not buying as much produce as high-income people. It turns out that everybody's spending about the same percentage of their food budgets on fresh produce. The problem is low-income people have less money, so they can only get a certain amount of produce. One of the ways that New York City Food Policy Group addressed this, I mean, you can't ask the farmers to charge less because then you plunge farmers into poverty. What they did instead was create a healthy savings card, working with a couple of the supermarkets on Staten Island and one of the other boroughs, and then also distributing these cards through Community Health Action on Staten Island, I think primarily Community Health Action. And what the cards did is you got $10, if you spent $20 on fresh produce, you got $10 off every week. So this is a real big impact on folks. Next slide, please. Now, City Harvest, we have what we're calling a three-pronged approach to maximize impact. So food distribution is we deliver food to food pantries, soup kitchens, and mobile markets. And I'll talk about the mobile markets in a minute. They're not the same as the mobile pantries that Community Health Action and Project Hospitality have, which are very interesting programs, but very different. When we're talking about an improved food environment, we're talking about healthy retail. In other words, low prices for produce and culturally desirable food. As you know, Staten Island has 20% foreign-born population. They're not everyone's going to be interested in winter squash. You know, there's a lot of different variations in the kinds of food people want to eat. Those foods are not always available in the food pantries or in the mobile markets. What's important is to give people the money or access to food at the stores so that they can buy their own to their own taste. Next slide. So we have this is a new strategy. So nobody will get food without education or education without food. So if you go to a food pantry, we're going to find ways to provide recipes and demos. Same thing with the mobile markets, and we're also working with schools. On Staten Island, we're working with 5 schools, one of which is we're going to have a food distribution at the school, as well as nutrition ed classes for the students. Next slide. So we deliver emergency food in general. Our goal is to ensure a consistent supply of free, healthy food to help relieve hunger and food insecurity. So we deliver to 10 soup kitchens and food pantries on Staten Island, including Community Health Action and Project Hospitality. And what we deliver is mostly produce, not the dry goods or cans. We really try to concentrate on produce. And then we also have mobile markets, which are kind of like farmers markets, and we distribute produce to the people who come to the mobile market. Next slide. So we have 2 sites on Staten Island. They're hosted by NYCHA. It's Stapleton Houses and the Mariners Harbors Houses. We have a couple of staff, and then we have many volunteers handing out the food. And we usually deliver 4 to 5 varieties of food, and we give out bags of food based on family size. So if there's only one of you, you might get 4 pounds of apples and 4 pounds of squash and 4 pounds of bananas. If you have a larger family, you'll get 10 pounds each instead. We also do cooking demonstrations and hand out recipes, and we also have partners come, such as the Staten Island University Hospital outreach program. And we get about 200 to 400 households come to each Staten Island market to pick up the fresh produce. And we run them twice a month. And then we also, on Staten Island, we also don't ask any questions about income, and the food is all free. And the referrals, the Staten Island PPS partners have gotten cards. We originally started by restricting eligibility to particular zip codes. But if somebody has a referral card, it doesn't matter where they're coming from. We accept the referral card, and so they can get food at the mobile market. Okay, next slide. We also have satellites, and we're the only borough with satellite markets. What this is that different organizations come to our regular mobile markets and pick up food and bring it back to their sites. So Port Richmond High School has a pantry on their first floor, and they pick up food from us usually twice a month. West Brighton NYCHA houses, they also pick up food from us twice a month. And then a third site is a joint project of the Rumsey Pediatric Center with St. Mary's Episcopal Church across the street. And the volunteers from Rumsey pick up for about 30 families every month. We also expect the community College of Staten Island's pantry to start picking up as well. Next. And these are some very preliminary results from Kevin Hansman, a nutritionist at the Beacon Christian Community Health Center. It's a very small sample, but the results are interesting. So they had for example, weight, sample size 10, weight went, once people started coming to the mobile market, they dropped 0.6 pounds per person. Blood pressure went down. HbA1c went down. Total cholesterol went down. Triglycerides went up. And HDL-C and LDL-C went in good directions as well. So these are very small samples, but they're still provocative, interesting information. Okay, next. And we have calendars. Selena said that she would be willing to either post these or email them. It tells you when the markets are. Right now, these calendars are done by quarters, but the mobile market runs all year long, during the winter, summer. Sometimes if it gets very cold, we have an indoor distribution, but you can keep in mind that these things run all year long. Oh, and I just want to point out that what the mobile markets, we bring a tractor trailer worth of food, and set up tents and tables to distribute food outside generally. Only if it's really bad weather do we go inside, which makes it different from the mobile pantries that Community Health Action and Project Hospitality have, which you'll hear about next. And that's it. Thank you.
Oh, thanks, Susan. I just want to jump in here and just let everybody know, Susan did say that the mobile markets are mainly volunteer run. If you haven't gone to one to see the incredible setup and the incredible amount of people and families that come out to pick up produce, it's a wonderful place to go and volunteer and connect with people and connect with real nutritious food. So it's really an excellent option if you and your family or friends are looking for some way to give back to the community. I urge you all to check it out. It's such a fabulous enterprise. Thanks. And so next we are going to have the team from Community Health Action. That is Laura Del Pret and Megan Berardi. They're going to talk to you about their Community Access Center. So I'm just going to pass the mic. Thank you.
Thank you so much. So as you can see, Community Access Center is our location that is at 2134 Richmond Terrace. Next slide, please. So just a brief history of Chassis. It was founded in 1988 as the Staten Island AIDS Task Force. In 2004, we changed our name to Community Health Action of Staten Island. In 2015, we joined Brightpoint Health and became a member of Brightpoint Health. And recently in 2018, joined Hudson River Healthcare. So that is our little overview of our history. Next slide, please. Ooh, there you go. So some of our current services offered, it runs the gamut, which is one of my favorite things about this agency. I'm relatively new here. I've been here about 8 months, and I love that it's very well-rounded. So in addition to the community food pantry and mobile health, we do HIV and Hep C care management testing and prevention. We have our Next Step Resource and Recovery Center, which is 24/7 for people and families affected by substance abuse. So if you are struggling with sobriety, if it's 2 o'clock in the morning or 2 o'clock in the afternoon, you can visit Next Step. We have our learning lab here at Food Pantry where we have access to about 20 laptops or tablets, and we can host workshops and classes. Our mobile units, chronic disease management, also here at Pantry, and then the Arise Peer Training Institute. Next slide, please. And of course, we do have our roots were in HIV testing and management. And then through Brightpoint, we have other options like primary care, dental services. Additionally, we work with programs with HIV in prisons. We have a domestic violence program. And then, of course, SNAP and insurance benefits, which takes place here at Pantry as well. So if someone comes in to see one of our nurses and maybe they haven't been to the dentist in a long time, though Chassis itself doesn't do that, through Brightpoint Health and HRC, Hudson River Healthcare. I'm terrible with acronyms. We're able to then direct people to the services that they need, connecting them further with better access to healthcare. Next slide, please. Just you.
Oh, so my name's Megan Berardi, and I am a registered nurse, and I am the director of Health Connect out of our food pantry. So I'm just going to explain a bit about how we work. So our primary goal with our clients and as an organization is to remove any barriers between our clients and making sure that they're improving their health. And as a community-based network, we do a lot of wraparound services addressing social determinants of health. And we also get to work with people after they're presenting issue or problems such as hunger, overdose, domestic violence, whatever it may be, that's addressed. Next slide.
And some quick points on food insecurity on Staten Island. More than 55% of food pantries and soup kitchens reported not distributing enough food to meet demand. And on Staten Island, 1 in 6 children and 1 in 8 adults live below the poverty line. So we are a once-a-month pantry, but we do encourage people to come as needed. But we do often see that even though we're providing enough food for 3 meals a day for a period of 4 days, it's still at times not enough to cover clients. Next slide, please. So our food pantry is officially closed on Sunday. We distribute 4 days a week groceries, Tuesdays from 10 to 2, which is our senior-friendly day, Wednesday from 12 to 4, Friday from 2 to 6, and then Saturday from 10 to 2. But currently on Mondays between 11 and 1, we have one-on-one appointments with Health Connect and also SIEDC, which is Staten Island Economic Development Corps. What they do is connect local people to local jobs, which is a great asset, and they're here and they provide some resume guidance as well. And then additionally on Thursdays, though we're closed, we have chronic disease workshops that we're open for. In order to receive food from pantry, all you need to do is bring in some form of identification. It could be, a driver's license or a bill or a report card or even a Costco card. And then we also encourage people to bring bags for their groceries. People are shopped by family size, and it is a client choice pantry. So they get a shopping experience where a volunteer takes them with the shopping cart and brings them around our shopping area location. There is no income requirement or restrictions, nor are there residential restrictions. So we've had people come as far as taking public transportation on all the way from Harlem. And we've had folks come from Jersey, and then visitors who were staying with family coming from other locations even further away. Next slide, please. And you can see over the last 12 months, the mobile food pantry, which is the MFP, served a total of 8,513 people with an average of 4 encounters, each for a total of 33,256 food distribution contacts. And you can see the breakdown of by gender, age, and general clients. Next slide, please.
So at our pantry, we're not just food. We have a ton of other services that we offer. And Health Connect is one of those services where you can see a registered nurse. You can get some coaching on whatever your disease process is. And we also do SNAP and health insurance enrollment and recertifications here. And those are all done by appointment. But Health Connect, you can be seen at any time that the pantry is open, but we'll go into Health Connect a little more later.
Mm-hmm. And then we do offer hygiene bags, which has items like deodorant, toothbrush, toothpaste, shampoo, soap, a snack, clean socks, and water to clients. We do offer feminine hygiene products. We have a WIC Wednesdays where a WIC representative comes and is inserted within pantry. And what's great about that particular program is if her clients don't qualify for WIC, they can still shop, or then they can see our SNAP specialist, Edward Sanchez. We have the job assistance on Mondays. We have our little condom station where people can come and fill up for their condoms. And then we have the free, little free library, which is the little box in the picture. And it has really taken off. We give away on average about 100 books a month. So in the last 8 months, we've given away about 800 books. Next slide, please.
So a little bit about our Health Connect program. So it's very unique. It brings nursing staff right into the pantry, and we provide diabetes screening, education, coaching for people that have diabetes, pre-diabetes, and hypertension. Many of our clients are walk-in during our pantry hours, but we also schedule one-on-one visits. Along with the free health screenings, we provide nutritional support, health coaching, referrals to PCPs, as well as enrollment in disease management workshops that we also have at our pantry. And then we also do our social determinants of health assessments, which help us guide and refer our clients to what benefits them best. And we're able to follow up with them in real time. Next slide. And then we have our mobile health unit, which is a 45-foot mobile health. It's the size of a MTA bus. Yeah, so it's pretty big. And on there, it's kind of the same as the Health Connect program at the pantry. And then now we're just bringing that into the community. So we're able to offer the health screenings that we do at the pantry, plus we do harm reduction services, HIV, HCV testing, PEP and PrEP, and we also are connecting many of our clients to PCPs, dentists, women's health, whatever their needs are.
And then 50% of the time, or at least 50% of the time, the mobile health unit is paired with the mobile food pantry, which is all the good things that we do just on wheels. And we provide nutritious groceries to neighborhoods that have been designated food deserts all over Staten Island. We're out 4 days a week providing services at, I believe, 16 stops a month. Next slide, please. So over the last 12 months, the mobile food pantry served a total of 2,322 people with between 3 to 4 encounters, meaning they've come more than one time. So what happens oftentimes, because folks live in a food desert, if they know, because we put out our calendars at least monthly, and now we're going to be moving on to 3-month portion calendars, so it'll be December, January, and February. Since people know where they can find us, they will oftentimes follow the unit. So if they saw us in Midland Beach, maybe now they follow us to Midland Beach, and then they get served again. Next slide, please. So I am a big proponent of community programming. We have a lovely space, and we believe in utilizing it. So once a month, we provide yoga for seniors. 4 times a year, we do Saturday movies where we provide a movie, snacks, and then the movie we show is based on a children's book. So then the children also get a book relating to the movie and a recipe that comes out of the movie. So for instance, if we watch Ratatouille, the kids get a copy of the book, and then they get the recipe for Ratatouille, and the parents have an opportunity to shop pantry and make that meal. We talked about SIEDC. We do provide opioid overdose training and Narcan distribution. Stop the bleed training is essentially what a lay person can do, a non-medical person can do until during a crisis, until medical professionals get there. We've done mental health first aid certifications, community emergency preparedness, and then also we do cooking demos and healthy meal preps, providing recipes from things that maybe people aren't familiar with or they're hesitant to try. So the ongoing joke here at Pantry is that people are hesitant to try brown rice. So we always make sure that our cooking demos have brown rice and recipes to go with them. Next slide, please. So the Coast Guard double give back is just oh, hang on, I apologize. Can you go back one? There you go, excellent, thank you. So Partners in Good Work, some of our partners that we worked with, you'll see them here. For instance, of course, City Harvest, so thank you, Susan. Additionally, we work with organizations, some of them are very large and some of them are very small. So for instance, SAC, what they do is they make crocheted or knitted soap sacks. Studies have shown that people that suffer from food insecurity oftentimes will not have toothpaste. 44% of people don't have toothpaste to brush their teeth. So things like little soap pieces make a big difference. Soap stacks, you take all those little pieces and you use every last bubble. A lot of times we've seen clients utilizing them to hold their keys or maybe their meds, these little sacks, and they're reusable. I Support the Girls is a lovely organization that works with us to provide gently used and new bras. A lot of women coming out of domestic violence or homeless situations do not have bras, and people don't think about the absolute necessity of that type of item. I Support the Girls provides them for free to Chassis, as well as feminine hygiene products.
And we've also worked closely with the College of Staten Island with their nursing students to give them really great experiences as community health nurses. Next slide.
Chloe, I'll get to your question a little bit more at the end, if that's okay. And then Coast Guard Double Give Back. So this was one of my first amazing experiences at Chassis. We heard that, obviously because of the furlough in the winter, that Coast Guard was not getting paid. As a military wife, this is something that's near and dear to my heart. I got married on this base, so we were able to connect with Project Hospitality and some other partners and head over to the Fort Wadsworth. And we provided information, we provided guidance, we offered our nurses and our medical staff and all our services. In turn, when the furlough was over and the Coast Guard got paid, they were kind enough to donate the remains of their food pantry to our food pantry. What was funny was they had said that I should bring a truck, so I borrowed, Megan's truck, which is an SUV, and they laughed and laughed because there was about 4 rooms full of food, and it was an amazing experience. We pull up in this U-Haul full of food, and we were able to stock our shelves. They continue to engage with us, which is really phenomenal. About once a month, the Coast Guard will come and donate their time assisting us in pantry. Next slide, please.
And so we just want to leave you with this really great quote from Martin Luther King Jr. I have the audacity to believe that people everywhere can have 3 meals a day for their bodies, education and culture for their minds and dignity, equality and freedom for their spirits. We just want to thank you for giving us your time and your attention.
Thank you.
Thanks so much, Chassis team. Again, I just want to make a note that we're going to be taking all the questions and having the presenters address them towards the end. We have one more presentation. So again, thanks Laura and Megan. That was excellent. Chassis just doing some amazing things, and especially moving with the Coast Guard Give Back. I'd love that. And I think that we can all think of different ways and different things that we can do with our own organizations, families, schools, to really help this community of food service providers. So I'm going to turn it over to the Project Hospitality team to take us into the final presentation. Thanks.
Hi, Karen and Alex. If you could just enter in your audio pin, so do the pound sign, and then I believe your audio pin is 292 pound.
Hi, everyone. Sorry about that, a bit of a technical difficulty there. My name is Alex Hughes, and I'm the program director for the Food and Nutrition program for Project Hospitality, and it's my pleasure to be joining you today. Next slide, please. So it is the mission of Project Hospitality Incorporated to reach out to the community members who are hungry, homeless, or otherwise in need in order to work with them to achieve self-sufficiency, thereby enhancing the quality of life for our Staten Island community. Project Hospitality seeks to realize its mission both by advocating for those in need and by establishing a comprehensive continuum of care that begins with the provision of food, clothing, and shelter and extends to other services, which includes healthcare, mental health, alcohol and substance abuse treatment, HIV care, education, vocational training, legal assistance, and last but certainly not least, transitional and permanent housing. So as you see, we offer quite a wide variety of our services to our community members who are in need. Next slide, please. So here's just some statistics for you for Project Hospitality's food services. Agency-wide, we served and distributed close to 1.7 million meals in 2018, just a tad over 23% of that food being fresh produce. We're very intentional about trying to provide fresh especially New York State-grown produce to the community. Our funding sources include EFAP, HIPNAP, PHS, and that's in addition to the donations that we receive and the fundraising done by our fabulous community partners, and we certainly could not do all these things without them. Next slide, please. So that segues here into where a lot of that food distribution takes place, which is our food pantry and soup kitchen located at 514 Bay Street in Staten Island. If you want to contact our pantry, you can call us at 718-815-0800 as listed here. As you see, we have our food pantry distribution days on Tuesdays and Thursdays. Tuesdays, we have two separate distributions, 9 a.m. to 11 a.m., and then in the afternoon from 1 to 3 p.m., and then we have one pantry session on Thursday mornings at this location, also from 9 a.m. to 11 a.m. And our soup kitchen time falls right after the morning pantry session, so 11:30 to about 1 p.m. there. Next slide, please. So we are a client choice food pantry at all of our locations and almost all of our mobile route stops, and I can get to that a little bit later. But we're intentional about setting up our pantries to be client choice for a variety of reasons that we have listed here. Whether that be for limiting food waste, since people are getting foods that they want to eat. We certainly don't want to try to push anything on anyone that they don't want, and then they end up throwing it out. And a lot of these folks that we're serving really don't have an incredible amount of choice in their life. So, we're trying the best that we can to be intentional about that and providing choices where we can. And also, of course, as mentioned earlier in, I can't remember which presentation, but someone had mentioned that there are like dietary restrictions, whether that be for health or cultural concerns. So the client choice model is sensitive to that. So, of course, we get a lot of pork and things from Food Bank, but we're able to supplement that with other foods that we receive from our other donors, vendors, and partners. So we're able to offer, like we just had a large donation of goat meat, and we were able to give out goat meat the last couple weeks for our pantry during our pantry services. And at the end of the day, the pantries and the food and nutrition program's main goal is to provide hot, well, not always hot, but to provide nutritious meals and foods to the members of our community who are in need. So we are a once-a-month shop pantry at 514. Oh, that's good right there. Thank you. You can go on to the next slide. That's fine. Yeah. So we are a once-a-month model here at 514. There, however, is there's not a limit on the mobile route. And as you can see here, we do shop client choice by family size. And here you can kind of see like that breakdown, right, of what different family sizes, the different allotments of the meats or proteins, the fruit, the grains, and vegetables. So you can see those allotments down there. Next slide, please. And that goes into our other site, which is the El Centro Food Pantry, which is located at 221 Heberton Avenue in Staten Island in Port Richmond. As you see there, the hours of operation are Thursdays from 6 p.m. to 7:30, and then also Saturday mornings from 8:30 a.m. to 10 a.m. Next slide. Thanks. And then that goes into our mobile pantry. So as you see, we have our schedule there listed of our mobile pantry. We have our nice box truck there. And as you see, we really almost every day of the week, have a mobile stop. And again, we don't put the limit there that we put on our the shopping limit that we put at our 514 and 221 Heberton Avenue, 514 Bay and 221 Heberton Avenue locations. And also, I do want to reiterate that almost all the mobile food pantry stops are indeed also client choice. So, you know, we're intentional again about instituting that client choice model across all of our programs. Next slide, please. So then that transitions into our HIV services that we provide. So we're currently serving in our HIV services program 232 unique households that have at least one member diagnosed with HIV. And in 2018, we served 294 unique households with at least one member diagnosed with HIV. So our HIV services, we have a wide variety of them. We offer nutritional counseling. So we're really trying to tie in food and nutrition into the general wellness of the client, and we're trying to be as intentional as we can about providing very nutritious foods and recipes to the clients, and we want to provide those recipes and those nutritional education groups, as you see listed here. We cook these recipes with only ingredients that we receive here at the pantry. So then the clients know, and the people that we're serving know, that these things are possible, that these nutritious meals are possible, and that it's not, they're not, limited to, some of the more bland dishes. You can actually get really creative with the stuff that we get. We also are able to offer supplements, and our registered dietitian and nutritionist, she makes determinations on need there, or sometimes clients also provide doctor's notes. We also have the Positive Living Dinner, and that's so there's a nutritional education group that would happen right before the Positive Living Dinner, where they would learn about a new meal or recipe, and then we would bring out our dinner. And that dinner is really about promoting, a welcoming and a more upbeat environment for the clients. We really want them we really want that day and that evening to be something that they look forward to during their week. In addition to that, we also have a separate and confidential shopping day for our clients that we're serving that are living with HIV. Next slide, please. So that ties in to a great success story that we have. So we have a person that began, receiving services from the agency in 2010. This person was, experiencing unemployment, food insecurity, homelessness, and as you see here listed, had been diagnosed with HIV, and then things kind of spiraled from there. This person recently has started serving as a volunteer with the agency after receiving these services from us from a variety of different programs. And now this person cooks for hundreds of people weekly, and that's no exaggeration. And they're currently working on their food handler certificate and are hoping once that is attained that they will be able to then go back and attain full-time employment. So we're all, there's stories like this that you hear about a lot when you're working in this agency, and it's always great to, be able to brag a little bit about those people who have come out on the other side and are better for it. Next slide, please. So that ends my portion of the presentation. I'm now happy to turn you over to Reverend Karen Jackson, and she will talk about Project Hospitality's help centers.
I serve as the Director of Recovery and Community Initiatives for Project Hospitality, and I oversee all of the wraparound social services that are connected to our food and nutrition services at our pantries in both Stapleton and Port Richmond. We know that more than 62,000 households on Staten Island are already receiving SNAP benefits, but there are many households who are eligible for SNAP but not yet receiving it. And that's why any new client who comes to our pantries receives a free public benefits eligibility screening. And I have a team of bilingual benefits enrollers at both our locations who can help those clients to enroll in SNAP for the first time, to recertify their SNAP benefits, or to update their cases, or we provide help with mediation. We can also assist with enrolling in any other public benefits, whether that's preparing for a WIC interview, HEAP, cash assistance, SSI, or SSV. We have a team of health insurance navigators on site who can help our clients to enroll or recertify in Medicaid. We can help our undocumented clients to access emergency Medicaid, or to help our clients enroll in the health insurance plan of their choice through the New York State marketplace, including the Essential Plan. We have free legal counseling at both our locations. We provide civil counseling at 514 Bay Street and immigration help at 221 Heberton Avenue. So we do a lot of DACA renewals, green card applications, and can assist with naturalization as well. We provide a free tax preparation program that runs from January through April. This year, we intend to do at least 2,000 tax returns because we don't want our low-income neighbors to be spending a big portion of their tax refund at a for-profit company. Instead, we invite those folks to come to our health centers where we have trained staff and volunteers who can submit that tax document, help people to get their full refund, and to make sure that low-income neighbors are receiving the earned income tax credit. Our staff are trained to assist people in domestic violence intervention. We work very closely with the Staten Island Family Justice Center, who comes on site regularly, as does WIC and Workforce One. At 221 Heberton Avenue, we have afternoon and evening ESL and GED classes. Those classes restart on a regular basis, so we're always glad to enroll new students. The Mexican Consulate also is at 221 Heberton Avenue several days every month to help people get consular IDs or their passports. We also have a health coach who makes sure that all of our clients, regardless of their immigration status, are receiving an annual wellness visit. And we check in with them after that doctor's appointment to make sure that they receive the language access that they need, that they understand how to take their prescriptions, and we can provide Narcan kits and training on request as well. Our health centers serve as the entryway to all of Project Hospitality's programs, whether that is being connected to our Health Homes program, to our Homeless Drop-In Center, our Youth Drop-In Center, or our Wellness Center, where we provide free counseling and substance use services. Once again, our health centers are in the same locations as our food pantries. In Port Richmond, that's at 221 Heberton Avenue. The phone number is 718-420-6466. We do have evening hours there. And our Stapleton location is at 514 Bay Street. You can call 718-448-3470 or 718-273-6737. And you can also email a referral for a client to access any of the services that I described by emailing our program director, Fanny Cordova, at fcordova@projecthospitality.org. Here at Project Hospitality, we love our volunteers, and we rely on our volunteers to run our food and nutrition services. This past year, we had over 1,000 volunteers serve with Project Hospitality's food programs, putting in 59,000 hours of volunteer service. One of our volunteers was actually just recognized at a mayoral ceremony and honored by First Lady Shirlane McCrae for serving the most volunteer hours this year in the whole city of New York. And so we always love to onboard new volunteers. To do so, just contact our volunteer coordinator, Eden Nagusin. Her email address is spelled out on the slide and will be available online. And her phone number is 718-448-1544, extension 165. So this concludes our presentation. And we do hope that you will share information on Project Hospitality's resources with all of our neighbors on Staten Island. Thank you.
Thanks so much, Alex and Karen. That was fantastic. To our attendees, we hope that you enjoyed the presentation today that we put together. We have a few questions to get to. So the way that this will work is that I'm going to answer the questions that I can, and then I'll address the questions to the appropriate presenter. We'll also enter the answers into the chat as they come up and they're being addressed. I did send a message to the audience, so we would love to hear from you. What moved you most? There was a lot of data, a lot of statistics. Were any of those statistics surprising to you? For me, it's unbelievable to know that even after serving over 2 million meals, there's still a meal gap. It's unbelievable to me that children who access lunch at school might be hungry at dinner. And I really feel moved to think about what we can do to address the reasons why people are living in poverty and might not have enough money on Staten Island and elsewhere to afford nutritious food. We didn't really even get into nutritious food versus food availability, and I think that that's a deeper conversation for some of us to have. But so if you want to, please answer my question in the chat, and then we'll get to them at the end. I want to know what moved you the most, what surprised you about the data, and what new resources are you going to use now? All right, so for our first question, we had a question for Nishama. Nishama, if you could please enter into the chat box, what is the best number for the JCC program to receive referrals? So I wonder, are we asking about the kosher food pantry or all of their referrals together? And we'll get that number to you in the chat box. Another question came through, and it was a link for the Staten Island Hunger Task Force, specifically for the calendar of soup kitchens and for either a downloadable or a searchable by map list of the pantries on Staten Island. So that website is http hungryonstatenisland.com, or in your browser, your Google bar, you can write in Staten Island Hunger Task Force, and that'll pop up. So we're going to unmute Susan Fowler now. The question is, how do I access a City Harvest referral card? And can private agencies give the referral cards to clients? If so, how do I access it? So, Reen, can we unmute Susan, please, to address that question?
Yes, I'm unmuted. Actually,
oh, great.
It's maybe a combination of you, Selena, and me on that one. The SIPPS has referral cards, and we have to get you some more. And what kind of private clinic would this be? Do we have any idea? And Selena, would you be willing to send cards to them, or do you think I would have to send it to them directly?
Yeah, so I think that's something that we'll have to take offline. So right now, I'll just give you a little overview of how we're using the cards. So Susan mentioned that City Harvest has 2 mobile markets in food deserts for the purpose to provide food, nutritious food access to people who would otherwise have to walk more than 20 minutes to purchase fresh produce. So the PPS have a partnership with City Harvest where our partner agencies can give a referral card, and people, regardless of their zip code, can go and access this free produce twice a month. So that's something I think that if you're interested in also offering to your clients, we could certainly have a conversation offline. And I'm addressing now Brianna and Safe Horizons. Oh, Safe Horizons. Yeah, okay. I think that that's fine. Are they both from Safe Horizons?
No, Brianna's the private agency. She was giving an example of Safe Horizons.
Okay. Yeah. Everybody has my email address. It's in the slide deck, and I'll be emailing you all a survey. So if you have questions on any of these resources, please just send me a quick email, and I'll make sure that we connect on that offline. The next question is from Juliet Douglas, and it's also addressed to Susan Fowler. And I think that I had we already addressed this. It's where can we obtain the calendar and locations of the mobile markets? So Susan, I know we added them into your slide deck, and we also are going to email them out to everybody with the slides after this presentation.
Okay.
We have one more question for you, Susan, and it's from Dr. Ginny Mantello. And the question is, what are the limitations to hosting mobile markets more frequently?
Time and money. Keep in mind that what we're delivering is a tractor trailer's worth of food. And we have to have a couple of drivers, 4 or 5 people from City Harvest managing the project, 10 or so volunteers. It's really a lot of effort to do a whole mobile market. And like anybody else, we don't have unlimited amounts of money. But we are coming up with smaller mobile markets, community distributions. We're going to try to do some distributions at a school on Staten Island. We're working on ways of doing smaller distributions that don't require an entire tractor trailer and 20 pallets of food coming in at one time. So that's basically what the issue is. It's expensive.
Thanks, Susan. And correct me if I'm wrong, but doesn't the pickup happen twice a month? And during that pickup, ideally, based on the family size, the people are getting enough food to last, enough produce supposedly to last them the 2 weeks until the next pickup?
That's the idea. And I think in many cases it's true. I mean, 10 pounds of bananas can last for quite a while, for example, or a large watermelon will last for at least a week. So yeah, we are trying to cover people for 2 weeks at a time.
Great, thanks. And just before you go, can you tell us where a majority of the produce comes from?
Oh, it comes from lots of different places. We actually are part of the Feeding America network, and they have an auction site, basically. We have a whole group of people here bidding on food and getting food from all over the country, the produce from all over the country, and also Canada. This is different. We also collect food from restaurants and stores, but not at the capacity that we need to manage. We bring in, I think this year we're bringing in about 60 million pounds of produce, and redistributing it to the various pantries and soup kitchens and mobile markets throughout New York City. So there's no one location where we could get that much food without actually buying it directly from farmers. But right. We pay pennies on the dollar. We don't pay full price. Okay,
great, good to know. All right, thanks, Susan. We're going to just put you back on mute. If something else comes up, we'll reach out. And the next question we have is for the chassis team. So we'll have to unmute Megan Berardi. And the question is, what is Stop the Bleed training? Yep. Can you explain a little bit more on what is the Stop the Bleed training that you have?
Sure. So this is Laura. So I have a background in emergency management, and some of that has kind of made its way over here to chassis. So Stop the Bleed, traditionally, a lot of people associate it with active shooter events, but it also can be used and utilized during a time of crisis, earthquake, even a car accident. And what it is basic life-saving skills that you can do to stop someone from bleeding out during the time that you're waiting for emergency help to come. So during, say, an active shooter, the first responder is the person standing next to you if you're injured. Last year, a gentleman who had taken Stop the Bleed saw an accident on the Goethals where a motorcyclist was hit and pinned between cars, and he utilized Stop the Bleed techniques, which includes tying a tourniquet, and save the person's life. Though New York has some of the best response in the nation, we have about a 4-minute response. 4 minutes is a very long time when your body is in crisis. So it's teaching what the average person can do to save a life.
Okay, great. And if anybody has any more questions about that Stop the Bleed program, we'll be sharing the speaker's contact information, and please feel free to contact Laura from Community Health Action of Staten Island for more information. The next question is for our Project Hospitality team, for Karen and Alex. The question came from Jacqueline Sierra. It is, do you have this program in New York City? So
I'm guessing Manhattan, or
are you,
out of the
yeah. Could you just elaborate a little bit more in the chat box, Jacqueline, if you're still with us? We'll wait a couple of minutes to and come back to that question so we can get more information. I just want to be able to connect you to the right presenter for that. And then we had one last question. Are there any resources for people who are homebound due to mental health and Medicaid health problems? Yeah, so we do have plenty of resources that are, I'm going to just field this question myself. We have plenty of resources to share for people who are homebound. Many of the providers and community-based organizations in our network do provide home visits or home drop-offs. I know I saw Joe Tornariello from Meals on Wheels signed in, and they provide meals to people who are homebound. I can get you a list and share that with you. And if you have any specific services, is this related to food in particular? I'd like to learn some more, so I'll reach out to you separately. Thanks. And okay, yeah. So Karen and Alex, do you have any services in Manhattan? And that question is from Jacqueline Sierra.
So we're based in Staten Island.
I don't know if you heard. I don't know if you're able to hear Karen, but no, we do not. We are only based in Staten Island.
Thank you both. But so there are many services, many food services and programs based in Manhattan. So I'm sure that we can help align some of the services available there with your needs, Jacqueline, and I'll reach out to you privately to follow up on that. Okay, so I think that we had a wonderful presentation. I just want to say thank you to our speakers from City Harvest, Community Health Action of Staten Island, and Project Hospitality. Thank you so much for sharing your knowledge and experience and expertise, and also highlighting the services that your organizations provide. To the attendees, thank you so much for being with us for this hour and a half. I hope that you were surprised by some of the data, and that you were moved to have these conversations, and that you start to use whatever privilege you have to think about how we address these food insecurity issues upstream, so that when we have these food services, there is no more meal gap the next time that we have this conversation. Please reach out to me if you have any questions, and we are looking forward to seeing everybody at our next webinar on the housing crisis on Staten Island and the housing resources and services available, and that's going to be on October 8th. Hope to see you there. Okay, thanks everybody.